Approximately 33% of people with influenza are asymptomatic. Symptoms of influenza can start quite suddenly 1 to 2 days after infection. Usually the first symptoms are chills or a chilly sensation, but fever is also common early in the infection, with body temperatures ranging from 38 to 39 degrees Celsius, approximately 100 to 103 degrees Fahrenheit. Many people are so ill that they are confined to bed for several days, with aches and pains throughout their bodies, which are worst in their backs and legs. Symptoms of influenza may include fever and extreme coldness, chills, shivering, shaking, rigor, cough, nasal congestion, runny nose, sneezing, body aches, especially joints and throat, fatigue, headache, irritated, watering eyes, reddened eyes, skin, especially face, mouth, throat and nose, petechial rash in children, gastrointestinal symptoms such as diarrhea and abdominal pain may be severe in children with influenza B. It can be difficult to distinguish between the common cold and influenza in the early stages of these infections. But a flu can be identified by a high fever with a sudden onset and extreme fatigue. Influenza is a mixture of symptoms of common cold and pneumonia, body ache, headache, and fatigue. Diarrhea is not normally a symptom of influenza in adults, although it has been seen in some human cases of the H5N1 bird flu, and can be a symptom in children. The symptoms most reliably seen in influenza are shown in the adjacent table. Since antiviral drugs are effective in treating influenza if given early, see treatment section below. It can be important to identify cases early. Of the symptoms listed above, the combinations of fever with cough, sore throat and/or nasal congestion can improve diagnostic accuracy. 2 decision analysis studies suggest that during local outbreaks of influenza, the prevalence will be over 70%. And thus patients with any of these combinations of symptoms may be treated with neuraminidase inhibitors without testing, even in the absence of a local outbreak. Treatment may be justified in the elderly during the influenza season as long as the prevalence is over 15%. The available laboratory tests for influenza continue to improve. The United States Centers for Disease Control and Prevention (CDC) maintains an up-to-date summary of available laboratory tests. According to the CDC, rapid diagnostic tests have a sensitivity of 50 to 75% and specificity of 90 to 95% when compared with viral culture. These tests may be especially useful during the influenza season, prevalence equals 25%, but in the absence of a local outbreak, or peri-influenza season, prevalence equals 10%. Occasionally, influenza can cause severe illness including primary viral pneumonia or secondary bacterial pneumonia. The obvious symptom is trouble breathing. In addition, if a child, or presumably an adult, seems to be getting better and then relapses with a high fever, that is a danger sign since this relapse can be bacterial pneumonia.